Mixed fiber sources oftentimes are included in therapeutic prescription diets. So you're covering the spectrum of the highly fermentable, the highly soluble, also the low soluble and low fermentable fibers so that you can meet in the middle for this perfect combination of fibers that cause less bloating and flatulence, but also their stool improves, but also their total GI health improves.
What's up, VetFolio voice listeners? Dr. Cassie here. This episode is sponsored by Hills and features Dr. Rachel Kurzbard, who joined me to talk about the role of fiber in the body and in managing conditions like chronic enteropathy. So, is it weird that I remember exactly where I was when I learned what a high percentage of chronic enteropathy cases are responsive to nutritional intervention? I feel like this was a really exciting revelation because these cases can be difficult to manage. And, with the options I had early in practice, I always hated the idea of long-term antibiotics as a go-to strategy. But, sometimes I felt like I really didn't have any other options for these patients. Good news, we've come a long way from chicken and rice and long-term antibiotics. And please don't get me wrong, I am not trying to paint with an overly broad brush and say that there's never any practical application for those types of management strategies. But fortunately, now we have a much deeper understanding of GI disease and many more first-line management options. And with this increase in understanding about the role of different nutrients in managing enteropathies, our options have expanded so much from focusing primarily on highly digestible options to adding low-fat, hypoallergenic, high-fiber, and on and on. And it's this last category that we focused on for this episode. Dr. Kurzbard joined me to shed more light on the role that fiber plays in overall physiology and how it can benefit patients dealing with chronic enteropathy. And she made me feel a lot better about what feels like my very limited knowledge on fiber up to this point, making it clear that there's still a lot we're learning. There's a lot to uncover when it comes to nutrition. This is a really dense episode. We covered a lot of ground, so I'm going to stop there and introduce Dr. Kurzbard, and let's talk about fiber. Dr. Rachel Kurzbard is a board-certified veterinary nutritionist. She earned her Bachelor's of Science in Animal Science and Master's of Science in Animal Biology with a focus on the interaction between nutrition and immunity from UC Davis. From there, she earned her DVM at Western University of Health Sciences in Pomona, California. She completed an internship at Southern California Veterinary Specialty Hospital and a residency in clinical nutrition at the University of Missouri-Columbia. Dr. Kurzbard developed the nutrition department at Blue Pearl Pet Hospital in Irvine, California, before joining Peak Veterinary Specialists PLLC. When she's not working, she enjoys spending time with her family, especially near the ocean. We have that in common, Dr. Kurzbard. Let's get into our episode.
Microbiome science is a swiftly evolving field that has caught the attention of pet owners. Are you prepared to answer their questions? NAVC's brand new veterinary microbiome certification course will give you the skills to implement microbiome science in your daily practice and improve patient care. New research shows maintaining a balanced gut microbiome is vital for optimal nutrition, disease prevention, and longevity in pets. Register today on VetFolio.com.
Well, I'm joined in this episode by Dr. Rachel Kurzbard, and we're going to talk about fiber. I'm so glad we're talking about fiber. I have learned, I think, a lot about fiber in the last, year, maybe a little bit more than that. But I feel like there's still so much I don't understand about it. So thank you for joining me to hopefully provide some clarification here on what we know about fiber so far.
Absolutely. Thank you for having me.
Yes, yeah. I'm excited to get into it because it was more recently than I care to admit that I kind of started to wrap my head around some of the terminology we use around fiber. So, for instance, soluble versus insoluble seems like a good place to start. Can you talk to us about the difference between soluble and insoluble fiber? I feel like this is like an internal test for me where I'm like, do I understand it correctly?
Absolutely. There's a lot of nuance there. So, first, we should probably consider what fiber is in general. So, the non-digestible carbohydrates that play a role in maintaining gastrointestinal homeostasis. So, there's a mouthful. So, that can be classified in different ways. And the main ways of classification, or the primary means of classification, include solubility, like you mentioned, insoluble versus soluble, so how well it can dissolve, and fermentability. If we start with fermentability, there's a continuum. So it starts off with non-fermentable, slowly fermentable, moderately fermentable, and then rapidly fermentable. So that's how well the fiber can be fermented by the microbes in the gut. And it results in production of metabolites, so short chain fatty acids primarily. And as that fermentation rate increases, as you have your rapidly fermentable fibers, in general, the fecal bulk, so the amount of stool production, is decreased. And the metabolite production, so the amount of short chain fatty acids that are produced, increases. So the more rapidly fermentable the fiber is, the more short chain fatty acid production there is in general. So then for solubility, it's also a continuum. So like fermentability, we've got completely soluble fibers. So like your guar gums, your pectins, those tend to be both highly fermentable and highly soluble. So then on the other end of the spectrum, you have your low solubility, low fermentability. That's your cellulose, your hemicellulose, peanut hulls, and others. And then somewhere in the middle, you have your pumice, your grape pumice, tomato pumice, pea holes, psyllium, those sorts of things.
Yeah, I think I had made it through like the first sentence of what you said, as far as my understanding of fiber. So that was really helpful. I actually did not, I don't think I realized that there was different degrees of fermentability. Is that a word?
Yeah.
All right. In insoluble fiber, but that makes sense to say that if you're fermenting rapidly, you're going to reduce the bulk and increase the metabolites. I guess where I kind of went, wait, what? Was when you said you have this fiber that is both soluble and fermentable. So I get, if I think of soluble fiber, like it can dissolve, and we're thinking of fiber that sort of coats the inside of the intestines, right?
Mhm.
And then, and so are we saying like a portion of that fiber will make it into the colon where it will be fermented? Is that what that
hmm
means?
Yes, yes. So
Oh,
it will
yay.
pass through the GI tract into the colon where it's fermented by the microbes there. And the high soluble fibers and the highly fermentable fibers, those are your gums, your pectins, those will be more present in the GI tract for the fermentation to take place. And then they're fermented rapidly. The
Okay.
insoluble fibers, they tend to pass through the GI tract mostly unchanged. So your cellulose, your hemicellulose, that continues as is. So low fermentability, low solubility, but it has a high water holding capacity. So it
Mhm.
increases the fecal bulk because it brings water along with it.
So fiber is not fiber is not fiber. There's a
Great.
lot of variation.
Exactly. Great point. There's a lot of nuance there. It's fibers are mixed carbohydrates. There's different components there. It's not a one-stop shop.
And the metabolites that are being produced, the short chain fatty acids,
Mhm.
what are the short chain fatty acids that are being produced and what function are those serving?
Sure. So primarily your short chain fatty acid production includes your acetate, propionate, and butyrate, and those serve excellent purposes to ensure colonocyte health. So butyrate is the primary short chain fatty acid that allows for colonocyte maintenance of absorption of sodium and chloride. It promotes a healthy epithelium. It improves colonic blood flow. So it serves numerous purposes within the colon. And the butyrate is feeding your colonocytes so it can allow the colonocytes to maintain that barrier.
So when we refer to something as like a prebiotic fiber, is that's what we're talking about, right? Are these fibers that are making it to the colon and they are producing these short chain fatty acids like butyrate?
Sure. So the prebiotic fibers, those are what are feeding the host microbiota. So the
Oh,
prebiotic
okay.
fibers are what the microbiome, the bacteria in the colon, are feeding upon to produce the short chain fatty acids through fermentation. Remember the rapidly fermentable fibers? So
Yes.
they are producing these short chain fatty acids.
Got
So,
it.
and when they produce those short chain fatty acids, those short chain fatty acids do a number of different things in the colon. So they are the energy source for the microbes. Like I mentioned, butyrate primarily is the energy source for colonocytes. They also provide some host energy through portal circulation. So through the circulation of the bloodstream from the gut. So that is less than 5% of the total host energy. So that is why, and we'll get into this a little bit later. That's why there is no minimum dietary requirement for fiber per AFCO. So because it's less than 5% of the host total energy, the total calories that the dog or cat's taking in, it's not considered an essential nutrient. But it has many properties that are beneficial. So going backwards, when those rapidly fermentable fibers, so you've got the guar gum that's present in the diet, it makes its way into the colon and the gut microbes feed on it. So primarily your bifidobacterium and your lactobacillus, they're feeding on these prebiotic fibers and then they're producing short chain fatty acids. So butyrate, propionate, acetate, and those short chain fatty acids change the microenvironment of the colon. So they lower the pH, which helps reduce the likelihood of bad bacteria colonizing the gut. It allows for more propagation of the good bacteria, and it serves as energy for those microbes itself and for the colonocytes. So it's doing a number of things within its sort of microenvironment, but it's also playing a role in total host health because it's reducing the availability of binding of the bad bacteria, so the E. coli and other species. And it's also preventing colonization just by a physiologic mechanism. So it can form a biofilm or it can have these kind of pseudo binding where it prevents other bacterial species from binding. So not only does it play a role in the microenvironment of the colon, but also for total host health as well.
I gotcha. I gotcha. And you're right. Like we'll get into this in a little bit, but it makes sense what you're saying about why there's no minimum requirement for AFCO because it's not necessarily a source of energy, but definitely that that
For
not
the host. It's not a
for the
source of
host,
energy for the
right?
host, but the short
But for
chain
the
fatty acids are
yes,
what feed the colonocytes, and you want to maintain your colonocyte health. But this is a not well studied in both dogs and cats. A lot of the literature that we have, or a lot of the information that we have on fiber, is extrapolated from human studies. There are studies on dogs and cats, but there are not as many as there are in humans, which is the case for most of veterinary medicine in general.
sure, sure. We're catching up slowly but surely.
We're doing our best.
We are. And I would argue there are some areas where we're charging ahead, but yeah, nutrition is a lot of times we're catching up and I'm so glad that we're learning about this because, we've talked about, oh, we need to supplement fiber for years, maybe in dogs with diarrhea and things like that. But, kind of like you've made abundantly clear here, fiber is not one size fits all. There's so many different things to consider when we're supplementing fiber. So, what sorts of cases should we think about where we should keep fiber supplementation in mind? And then let's talk about how we do that, how we supplement the fiber. Like, I guess, yeah, starting with who gets the fiber, and then how the heck do we do that?
Yeah, that's a great question. So I would say the majority of research in dogs and cats is on gastrointestinal disease primarily. So acute diarrhea, chronic diarrhea. So a couple of studies, a fairly recent study with dogs and acute diarrhea. This study was done by Rudinsky and others in 2022. There were three groups of dogs with colitis, and they were fed three different diets with different properties. So the one diet was they're all highly digestible diets, but one diet had a placebo, another diet had metronidazole, and another diet was fiber enhanced with psyllium. And what they found was that with the dogs fed the higher fiber diets, they had a faster resolution of clinical signs and improved fecal scores. So the recurrence rate of the colitis in the dogs that were fed the diet with fiber was less than the recurrence rate of the dogs that were fed the diet with metronidazole. So this, I think, is where a lot of us in clinical practice kind of reconsidered the use of antimicrobials as a first step when dogs have acute diarrhea, because as this paper showed, the time to resolution was actually better with the highly digestible diet plus fiber. So that's certainly a reason to reach for a fiber enhanced diet or fiber supplementation in general. There have been a couple of other studies on shelter puppies, fewer in cats, but the important thing to note in those studies is that even if there wasn't a difference seen between time to resolution or improvement of clinical signs, there weren't severe adverse effects seen when fiber was supplemented. So that's always beneficial, is you're not making it worse. This is an option to make it better. So that was acute diarrhea. And then for chronic diarrhea, there have been fewer studies, but in general, fiber addition is the most common nutrition recommendation for addressing chronic colitis in dogs. And the studies that evaluated psyllium husk addition, the median dose of the psyllium husk addition in those dogs was about 2 tablespoons per day. So that, if you were wondering where that dose came from of 2 tablespoons of psyllium husk per day, it was from that paper where dogs were offered highly digestible diets with the addition of psyllium husk that ranged from 1/4 tablespoon to 6 tablespoons per day. And the medium dose that improved clinical signs was the 2 tablespoons of psyllium husk. I will say from that, and this is anecdotally speaking, this is not evidence-based, but it is important to note that fiber, like we mentioned initially, is not a one-size-fits-all. It's not a one-stop shop. So if I am recommending fiber for my patients, I will recommend initially starting off at a very low dose, which I would recommend in general because fiber changes gastrointestinal transit time. It can the fermentation in highly fermentable fibers can cause bloating and flatulence, and it takes time for the microbes to adjust to the addition of fiber. So if you imagine a similar situation in humans, if you've never had fiber before and you decide to take a cup of Metamucil, you're going to feel that. And it's probably not going to be terrific for you. So in the same vein, for dogs and cats, if you want to work up to the dose, 2 tablespoons is kind of your idea of what you would consider working up to, but it can vary among individuals. So I would start much smaller than that.
Yeah, that makes sense. Sort of allowing the population of bacteria and their metabolism and things. This is how it's working in my head. I don't know if this is how it actually works to adjust to what we're doing, so we're not causing GI upset.
Exactly. That's the goal, is give the gut a chance to adapt to the changes that you're making to it. And kind of going backwards into to other disease processes where we might want to use fiber, which in general, there are many, because there are many instances where fiber could play a role extrapolating from human studies, but we don't have the evidence in veterinary medicine to say definitively this will fix the problem. But theoretically, there are many reasons why we would want to use it. But the ones that are most studied, like I mentioned, are the acute diarrhea, chronic diarrhea, so colitis, hairballs in cats. The one main study looked at psyllium husk fiber in both long hair and short hair cats. And it did improve fecal excretion in long hair cats, not in short hair cats.
Okay.
So that might change the way you would consider supplementing depending on the length of fur of your patient. But other pure fiber sources did not have significant impact. So I would say that's largely patient dependent. And then the last one I want to touch on is constipation, because constipation can be a big problem in cats, primarily cats with later stage renal disease, because they're chronically dehydrated in many cases. The thing I want to press upon is that constipation is different from obstipation. So if you have a constipated cat, the cat can still has fecal capabilities, fecal motility, still has anal tone, is able to push out its poop. If the cat is obstipated and there is no anal function, there is no colonic motility, that is where you don't want to use fiber. So cats with megacolon, fiber is contraindicated because you really don't want to increase that fecal bulk. You want to make sure that the cat has the ability to let out whatever is present in there, and fiber is not the way to go in a cat with megacolon.
Because of the fecal bulk, but something like Miralax,
Right.
where we're pulling in water, would be just to keep everything soft, but not fiber that would also pull in water, but that would increase the fecal bulk as well.
Correct. So in cats with megacolon, you don't want to use something like Metamucil, where you would be increasing the fecal bulk because they have no means to push it out. So in cats with obstipation, it's recommended to feed a highly digestible diet if a subtotal colectomy is not performed, or even if it is, you want to minimize the fecal bulk that's there, and often using things like lactulose to encourage softer stool and emptying.
That makes sense. It seems like a really important distinction to say, like, yeah, lactulose, yeah, things like keep it soft,
Yep.
but reduce the bulk,
Reduce the
as
bulk.
opposed to like a constipation type of cat.
Absolutely. Reduce the bulk. And then going back to the question that you asked about how we get this fiber into them, the most ideal way would be through veterinary therapeutic fiber enhanced diets. And the reason I say that is because those diets have the capability to take into consideration the total fiber content of the diet as well as all other components of the diet. So the diet is complete and balanced as is with the fiber added. So because of the possibility for fiber to interfere with nutrient absorption, granted that has not been studied extensively in dogs and cats, that's mostly from extrapolated from human studies where fiber has the possibility to interfere with mineral absorption, and it can impact a fecal bile acid excretion and other things that we want to keep in mind. But the veterinary therapeutic diets have been formulated with that in mind. So we don't need to worry as much if, say, for example, we're dosing a dog with a very high dose of fiber. We do need to consider if that fiber isn't already present in the diet, is that going to have an impact on the nutrient digestibility and bioavailability of that diet? So, for example, the weight loss diets, Hill's, Royal Canin, Purina, those diets tend to be the highest in total dietary fiber. So we're talking in grams per 100 kcal because metabolizable energy is how I think of terms in nutrition. So per 100 calories of food, that can be over 4 is generally considered high for total dietary fiber. So more than 4 grams per 100 kcal, but they can be up to 10 grams per 100 kcal in some of the weight loss diets. For total dietary fiber, we would consider less than 1 gram per 100 kcal. That's low for a dog. So, but if we're in that 10 range, that 10 grams per 100 kcal, that's a lot of fiber. And so you wouldn't be able to get to that level with other forms of supplementation without having some concern of the efficacy of the diet. So, for example, psyllium husk is a common dietary supplement for fiber. So 1 tablespoon of psyllium husk provides about 4 to 5 grams of total dietary fiber. So if you compare that to a diet that has 4 grams per 100 kcal, but you have a dog that's eating 1,000 calories, well, that's 40 grams of fiber versus 4 grams of fiber that the dog would be getting per day from the tablespoon of psyllium husk.
Wow, that's a huge difference. And thinking of psyllium, and correct me if I'm wrong, when you talk about potential interference with nutrient absorption, it's soluble, right? And so it's going to go and it is going to kind of coat the inner part of the intestines there, which creating an actual physical barrier. And that's where you start to get worried that we're going to have issues with nutrient absorption.
Correct. And to the best of my knowledge, that has not been studied extensively in dogs and cats, like I mentioned, but it has in humans. And we do know that there is some interference with mineral absorption and it can impact protein digestibility. So it is something worth keeping in mind. And from my perspective, for medication absorption, I want to make sure that those are given at different times as well. So we're not having any possible interference with the absorptive capabilities, even though it may not have been demonstrated in peer-reviewed literature, specifically in dogs and cats. There's still the possibility, and we don't want to take that risk.
Yeah, especially when we think about those higher dosages. Plus, I can't even imagine trying to get that much psyllium into a dog.
So, on that note, pumpkin, for example, is another commonly suggested fiber source to add to pet food. But the grams of total dietary fiber per cup of canned unsalted pumpkin per cup is about 7 grams. So keep in mind, you would need to be adding cups and cups of pumpkin to meet the same dietary fiber intake as one of these higher fiber therapeutic prescription diets. So it runs the risk of unbalancing the diet then.
Yeah, and I'm picturing my lab who's sleeping next to me, and he would be all about it. He'd say, "Great, like add as much pumpkin as you want to my diet. I will eat it all." I feel like that would not end well for either of us.
No, and sometimes in some cases it's contraindicated, right? Because if the patients are not willing or not able to eat that much bulk, then they're not going to get the fiber anyway because they're just physically incapable of eating that much volume.
Right. I'm thinking of like some of these cats where we're trying to supplement fiber that sometimes I wonder with pumpkin, because, we'll get those anecdotal cases where the owners will come back and say, I added pumpkin and it got better. And I'm like, I wonder if we're actually just adding moisture in the diet.
It's a great thought because it's so nuanced, right? And every dog is an individual. And there have been a couple studies evaluating the differences between large breed dogs and small breed dogs and how they interact with fiber differently. So I try not to discount what the clients tell me, even though a lot of it may very well be moisture content or just placebo effect.
Sure.
They added something expecting it to get better, and so it does. But dogs are very individual creatures, as are cats. So it is possible that even though there's 7 grams of fiber per cup, and so giving a teaspoon of pumpkin is really not giving you a gram of fiber, that may be sufficient for a teeny tiny dog or for that dog specifically to change the microbiota enough where there's some improvement. Is it likely? Not super likely, but it's possible.
Sure. Or like, and now I'm just going down the rabbit hole of like my theories of like, we know like feeding the gut is the best way to heal the gut. So if we have a pet who's hyperexic or anorexic and we put a little pumpkin in and they're like, oh yeah, I think I do want to eat. And the next thing you know, they're getting better. I'm like, yeah, maybe we just fed them and let the gut do its thing.
You fed the colonocytes. You
Yes.
fed the colonocytes and helped the colonocytes improve that gut barrier, have them feel better.
Yes. Oh, but anyway, I will keep going down the rabbit hole of all of my theories of why sometimes we see success when we don't expect it. But I know, we're not here to
Good
hear
theory.
all of my theories.
I like it.
I'm glad. That makes me feel better. I think it's good to talk about though, because I think we're learning more and more, and that message is getting out there that pumpkin, from the fiber perspective, isn't necessarily doing what we're trying to get it to do. I, however, did not appreciate the major difference between like psyllium supplementation and feeding a high fiber diet. I mean, that's a huge difference in fiber content. And I'm guessing in at least some of the veterinary therapeutic diets that we're seeing a mixed fiber, not purely psyllium.
Yes, thank you for bringing that up because that is another major difference is that mixed fiber sources can be included and oftentimes are included in these therapeutic prescription diets. So you're covering the spectrum of the highly fermentable, the highly soluble, also the low soluble and low fermentable fibers so that you can meet in the middle for this perfect combination of fibers that cause less bloating and flatulence, but also improve fecal bulk and fecal water content to the point where their stool improves, but also their total GI health improves because of the short chain fatty acids that are being produced and because of the microbiome differences that are happening. So a lot of them will include a good combination of fiber, so prebiotic fibers and other fibers.
Yeah, and you've done such a great job of painting a picture of the different kinds of fibers. I'm going to be honest that I hear, mixed fiber and I'm like, sounds great. No idea what that actually means. And
Lots
now
of
I
fiber
feel
types.
now I wouldn't say I have a good grasp on it, but it's starting to make sense where I kind of see what we're after here. And it sounds, like mixed fiber is the way to go because then we're coming at the gut from multiple different angles. But are there situations where fiber might be contraindicated or we really should lean hard one way or the other on the type of fiber we're supplementing?
Yeah, that's a great question. So when I mentioned earlier about obstipated cats, that I think as the primary, this is contraindicated in obstipated cats because you don't want to increase fecal bulk. You want to allow for easy passage of soft stool in the cats. The remainder are very much individual dependent. So, for example, gums, the highly fermentable, highly soluble, guar gums, pectins. If you think about gums, they gum things up, they gel things up. So they gum up your stomach. It slows the gastric emptying. So in patients that maybe have GI motility disorders or have delayed gastric emptying already, you don't want to delay it further. So we would want to avoid some of those highly soluble, highly fermentable gums. In others, if there is a known response already to insoluble fibers. So if they've got significant fecal bulking already, so say for example in EPI, exocrine pancreatic insufficiency, where they've got this large voluminous stool and you want to avoid contributing to that because already there's insufficient enzymatic digestion, you want to avoid fiber in those cases as well because you want the maximum amount of enzymatic digestion possible. You don't want fiber interfering with enzymatic digestion in dogs with EPI when you're adding the digestive enzymes to their food. So those I would say are the primary cases, but it's very individual because when one dog, if you supplement fiber with one dog, say, for example, psyllium husk, because that's what I'm talking about for the most part today, but there are plenty of other fiber supplements. There are mixed fiber supplements for humans and for dogs and cats. But psyllium husk is probably the most studied, and it is in the middle of in terms of solubility and fermentability, and it's got high viscosity, so it forms a nice gelish substance in water. So because psyllium is so viscous and it's forming this nice blockade, you don't want to use it in patients that need high digestibility, that have an intolerance to the fiber because you note when it's given that their stool quality worsens. So a lot of an individual's response to fiber will be determined through trial and error. So through putting them on a therapeutic high fiber or fiber enhanced diet or another diet, another therapeutic diet, or by supplementing fiber and monitoring the response. I do want to reiterate the importance of if we are supplementing fiber to increase very gradually because we can tell you with confidence that if a dog that has never had fiber before, say for example, is on an unbalanced home cooked diet of chicken and rice, if you suddenly add 2 tablespoons of psyllium husk, that dog's stool is going to be loose likely, and the dog's not probably going to feel so good. So you want to start small and increase gradually, and how gradually you want to increase, again, depends on the dog.
Yes, yes, as so much of nutrition does. It's such an individual science of how they're going to respond. And that's what I've heard a lot when it comes to treating chronic enteropathies and things is there is a degree of trial and error, but we are starting to kind of break it into these different categories of what we can trial and error and say,
Absolutely.
this is what we're trying to accomplish with this food, this is what we're trying to accomplish with this food and supplementation and so on. So it sounds like fiber is very similar in paying attention to what type of fiber we're supplementing and how we're going about adding that to the diet really is going to make a big difference to how each individual patient responds.
Absolutely. And because we can expect differences from diets that have mixed fiber sources, which is most of them, because most diets are not going to only include one fiber source, especially the therapeutic diets, that those responses tend to be better because the properties of the different fibers are symbiotic, right? They support each other. But if you only have one fiber, say just guar gum, then you've got just the properties of that one fiber. That's not necessarily the most beneficial for most individuals. It's a combination approach.
That makes a lot of sense. Do you ever get pushback from recommendations to add fiber to the diet? And, people say, well, why would I do that? It's just a filler. It's not doing anything. All it's going to do is make my dog poop more. And if you do get that pushback, you can tell maybe I've heard this before. How do you counter that perception?
Yeah, it's a great question. I would say I receive more pushback from owners in reading the ingredient list and seeing things like cellulose or lignin and pointing them out to me as though this is a problem. And then I ask them, tell me more about this and why is this an issue to you? Because from my perspective, this is not an issue. So what I hear is that because lignin and cellulose are not interpreted as foods that we as humans like to eat. They're parts of a plant, but people will see them as wood or cardboard or interpret it as cardboard is used in pet food as a filler. But now, hopefully, we know that lignin and cellulose are fibers that they serve a purpose to maintain gut health and improve gut integrity. They're every ingredient in pet food of the companies that we trust to produce pet food, which we can get into in a minute, but that's a whole other rabbit hole. But of trustworthy pet food companies, every ingredient serves a purpose. So lignin and cellulose are not going to be included if they don't serve a purpose because each ingredient is expensive. So we already discussed, what fiber can do for you, but going kind of blanket statement over the potential benefits of fiber, we've got metabolic regulation, so we can improve glycemic control by inhibiting from rapid glucose release by keeping food in the GI tract longer. We can help with satiety, so adding to that bulk of the food adds more volume, adds more moisture. When the highly soluble fibers are added that delay gastric emptying, that can help with satiety for improved fecal scoring. So improving the fecal bulk, the fecal form, the water content, depending. So psyllium, for example, is ideal for both constipation and diarrhea because of its properties. And then GI tract health and the microbiome in general, right? You're feeding the colonocytes, you're creating a better environment for the gut to do its job. And then there are other impacts that we know about in human medicine that haven't really been studied in dogs and cats, but cardiovascular, immune health, reproductive health are all potentials. So to the owner questioning why these ingredients are used, they are serving many purposes. They're not just fillers.
Feel like that's just like a mic drop moment right there. You're like, these are all the things it does. Now, what is your issue with this ingredient?
This is why, but also kind of tangentially related. Focusing on the ingredient list is not the first thing that I would focus on in a diet, which is a conversation I have with owners usually at least once per appointment because it tells you nothing about the quality of the ingredient that's used. So really, if you're concerned about a particular diet, you want to first look at who is formulating the diet and do they have experts in the field formulating these diets, especially if they're therapeutic veterinary diets. Do they have a PhD nutritionist or board certified veterinary nutritionist on their staff full time? Because if they don't fulfill that criteria, then I don't really look at the ingredient list because then I don't have faith in the company or the diet in general.
Yeah, absolutely. And can you pick up a phone and find that out?
Yes, yes, you can, and I encourage them to do so.
Yeah, and my point being, if you can't, then then
Oh,
there's another question.
that's a great point because I will encourage clients to do that and say exactly what you just mentioned. If they don't tell you that information, that's a bit of a red flag.
hmm Yeah, I mean, we want transparency in what we're eating.
Transparency.
And so we want transparency in what our pets are eating. And yeah, and to know that the people who are formulating these diets are qualified and know what they're doing. And like you said, that the ingredients we're seeing serve a purpose. And yes, and then explaining what that purpose is and saying, okay, now what?
Right.
Real quick here, I want to be respectful of your time, but you mentioned the ingredient list and things like that. And I want to talk about labeling for a minute.
Mhm.
I know that there is this pet food label modernization project that is changing how pet food labels work. And I'll be honest, I know just a tiny bit about it. How is that going to change the pet food label, and how is it going to change our ability or affect our ability to make recommendations, obviously for the sake of this conversation, based on fiber, but I guess also just in general?
Yeah, that's a really great question. I'm glad you brought it up because AFCO, the Association of American Feed Control Officials, they set guidelines for the minimum and maximum nutrient concentrations in pet food, but there is no minimum set for fiber. And if you're looking at pet food labels, you'll see a guaranteed analysis because that's what's required to be on a pet food label that tells you maximums and minimums. So, of protein, fat, and fiber, there's crude protein, crude fat, and crude fiber. And it will only indicate either maximums and minimums of those. So, it doesn't actually tell you about the total content in the diet. It's just a maximum or a minimum. If you want the actual value, you have to call the company and ask them or look at the veterinary product guides that are available. But what is changing by the year 2030, and I believe this was proposed in 2015, so we're getting there. The pet food label modernization project is going to change the crude fiber maximum to be total dietary fiber. And that is exciting because crude fiber only shows you a portion of insoluble fibers in a diet. So it's grossly underestimating the total amount of fiber in a diet, but also the label's only showing you the maximum, so it could be less than that. But crude fiber measurements only measure a portion of insoluble fiber. So no soluble fibers measured at all, and then only some of the insoluble. So now total dietary fiber measures both soluble and insoluble fibers, so you can more easily compare diets. Now, that said, it's still difficult to compare if it's only a minimum or only a maximum. So using the product guides is more beneficial. And right now, at least, the majority of veterinary therapeutic diets will have the total dietary fiber content on them, and you can compare labels by 1,000 calories or by 100 calories. That will give you a good means of comparing individual diets versus doing as fed basis, which isn't a decent comparison.
Do you know if the total dietary fiber is going to be expressed as a maximum or a minimum?
I believe the labeling is supposed to more closely reflect what human food looks like. So it should be expressed in grams and grams per serving.
That was kind of my understanding of it when, we talked about it a while back. And yes, that it was sort of replacing the guaranteed analysis because we're not really learning a lot from that guaranteed
Yeah.
analysis.
So on that, the guaranteed analysis, oh, it is, I know this is tangential. However, there is a really useful tool that I indicate to clients when they're trying to compare food. So this doesn't help for fiber, but it helps for comparing pet food if they're just looking at labels in the grocery store, is that if you go to balanceit.com,
hmm
there are sections across the top, and there's a guaranteed analysis converter button. So,
What?
yes, so you can plug in the numbers in the Guaranteed analysis, if you click on support, then there's 4 little boxes, and one of them is guaranteed analysis converter. So if you click on that, you fill it out, it will tell you on a metabolizable energy basis, it will give you an idea of percent of calories coming from protein, fat, and carbohydrate. It is an incredibly useful tool. I recommend it to clients when they tell me they're looking at the guaranteed analysis on their food and like, well, that's not going to tell you anything. Back to your question. So I was looking at it and it still looks like it's a maximum, but it is a maximum of total dietary fiber.
Yeah, which is still obviously much more useful than crude fiber.
Yes, it's still an estimate, but it's a closer estimate. Also, crude fiber measurements are just very poor in general. So it's still better, and you could still more accurately compare food than what you could do right now. So
Sure.
not perfect, but progress.
Yeah, I mean, I'm thinking if you have say a lower fiber diet and then versus one of these high fiber diet that has really, really high, like that's going to be a big difference on the label.
Absolutely.
Well, Dr. Cusbert, I have learned so much, and I'm going to have to, I feel like, go back and listen to this again to wrap my head around all of it again, because there's so much great information here about fiber and how we should think about it and what it means to supplement fiber when we should, which it sounds like most of the time, make sure there's good fiber content. And then those cases where we need to be a little bit more careful. Thank you. Thank you. Thank you. Thank you so much for the conversation. Is there anything else that we didn't touch on that you want to add in?
No, I think we covered a great deal in the time we had, and thank you again so much for having me. It's been delightful.
Yes, I have really enjoyed the conversation. Well, thank you so much to everyone for tuning in. Thank you to Hills for making this episode possible. And Dr. Kurzbard, I really appreciate you coming on the podcast. Such great information. I learned a lot. So thank you again. If you did enjoy this episode, please leave us a 5-star review wherever you get your podcast to help other veterinary professionals like you find this and other great content we're always trying to put out there. If you'd like to hear more episodes, you can click on the Education tab on the VetFolio website or find us wherever you get your podcasts. Of course, tell me your thoughts on this talk as well as what you want to hear from us in the future. Reach out to me at dvm@vetfolio.com. You can also find me on Facebook at Dr. Cassie DVM or on Instagram at dr.cassie.dvm. And remember, if one animal is better off because of you today, it's a great day.